Palpate is the calcaneofibular ligament. It originates in the lateral malleolus right here, goes almost straight down and crosses the subtalar and the talocrural joints and attaches on the tubercle of the calcaneus. All right, so the next area we're going to palpate is the greater trochanter. It's located at the top of the thigh bone. It's the most prominent and widest part of the hip. When you point to your hip, this is usually what people will point to. So the easiest way to palpate it is to pop your hip out to the side, and then you palpate said side. It should stick out almost like a baseball. So the next structure we're going to palpate is the MCL. So what you want to do is have your patient lay supine with the knee in flexion. And what we're going to do is we're going to find the joint line. So the best way to do that is to go right above the tuberosity to the apex of the patella. What we're going to do is we're going to move our fingers immediately until we fall off of the joint line, and then we'll be right on the MCL. And what you can do is you can palpate all the way up to the medial epicondyle, and then all the way down to the pes anserine. All right, so next we're going to do the Lachman test to identify an ACL rupture. So with these special tests, first you want to do it on the uninjured leg to get a baseline of how the patient's doing and to compare it to the injured leg to see if there's any give or resistance. So what we're going to do, we're going to make sure the patient's supine. We're going to take their leg, bring it in around 20 or 30 degrees of flexion. And what we're going to do is place our hand on the distal femur and our other hand on the proximal tibia. And we're basically just going to push with this hand, pull with the bottom hand to see if there's any give. All right, so now to the injured side. This is the side that has the ACL rupture. So we're expecting a positive test. We're going to do the same thing. Bring it into 20 or 30 degrees of flexion. Distal femur, proximal tibia, push and pull. And there will be a lot more give than in the uninjured leg. And then that would be a positive Lachman test. All right, so next special test we have is Apley's compression. This is a test to identify a lateral or medial meniscus tear. So same as the Lachman test, we're gonna test the uninjured side first to get a baseline of the actual injured side. So what we're gonna do here, patient is gonna lay supine, and we're gonna bring their leg into 90 degrees of flexion, and we're gonna support it with our own leg. And what we're gonna do, we're gonna go hand on the bottom of the foot. We're gonna push down and rotate laterally and rotate medially. And so basically what you're looking for is you're looking for a decrease in rotation on either side, and that would basically tell you if there's a lateral or a medial tear. All right, so now we have the actual injured side that we're gonna perform the Apley compression test on. So same deal, 90 degrees of flexion, support with your own leg, hand on top, give pressure down, and we're gonna rotate laterally and medially. And a positive sign would be a decrease in rotation to either this lateral or medial side. First area we're gonna palpate is the pes anserine. So what I'm gonna do is I'm gonna hold on to the tibia with the thumb facing medially, and then we're gonna slide upward until we're about 3 finger lengths and 45 degrees away from the tib tuberosity, and right under our thumb is where the pes anserine is going to be. And basically at the pes anserine, it's the attachment site for 3 muscles, the sartorius, the gracilis, and the semitendinosus.
All right, and then from the triangular subcutaneous area, we're going to move medially, and we're going to find the inferior tibial fibular joint, which connects the distal fibula and tibia together. And this joint is categorized as a syndesmotic synarthroidal joint.
All right, so next we're going to palpate the navicular tubercle. So what we're going to do is we're going to come 2.5 centimeters anterior inferior from the medial malleolus, and it'll be on this little bony area right here. And what this is an insertion of the plantar and medial navicular ligaments and the posterior tibial tendon.
All right, so we're going to move laterally from the tibial tuberosity, and we're going to find the fibular head over here on the lateral side of the leg, which is going to serve as an insertion point for the biceps femoris tendon coming from the hamstring.
Right, so next we have the Trendelenburg test. As you know, with these special tests, we always run it on both sides. First on the healthy side to get a baseline, then we'll run it on the injured side. So basically what this test is you'll have the patient put one of their legs into flexion. So we'll start with that right leg. We'll put that right leg into flexion. And what you're looking for, you're looking to see that the iliac crests stay level. If they're not level, that would be a positive test. So what would happen is the side that you have in flexion would be almost angled downwards, and that would be a sign of a weak glute med. So we'll put the good leg back down, and we'll pick up the so-called unhealthy leg. So we'll pick that up, and if it was actually unhealthy, we would see a drop in the iliac crest, and that would signify a weak glute med.
All right, so we're going to test the Achilles tendon reflex. So we're going to hold the foot on top of our forearm, and then tell the patient to relax their foot on my arm. And then we're going to try and find the Achilles tendon on the back of the leg. And this tendon actually serves for the gastrocnemius. And we're going to look for plantar flexion when we tap the heel. So we're going to like that, and we see we have a little plantar flexion, which shows that his Achilles tendon is in fact intact.
All right, so the next area we're going to palpate is the adductor tubercle. So what we're going to do is we're going to start with our fingers on the medial epicondyle. And what we're going to do is we're going to move our fingers 2 centimeters proximal from the medial epicondyle, and we'll be right on the adductor tubercle. And the adductor tubercle is the spot of insertion for the adductor magnus muscle.
All right, so we're going to find the lateral femoral epicondyle. So we're going to move laterally from the patella, and we're going to find a bony flare out right here of the femur. So that's the lateral femoral epicondyle, which serves as the insertion site for the LCL, which runs down and inserts onto the fibular head.
All right, so next we're going to palpate the deltoid complex, which is a series of ligaments that come off of the medial malleolus in a fan shape. And so what these ligaments help to do is they help to resist eversion of the foot, and also these ligaments insert on the medial talus.
All right, so to perform the ankle AD test, we're going to put the knee in slight flexion to keep it in an open pec position. And then we're going to rest the foot on our forearm. We're going to support the leg right above the ankle. And what we're going to do is we're going to attempt to pull the foot anteriorly. Since this is the uninjured side, it's going to show a negative test. We're going to have some resistance, minimal give, showing that his ATFL is in an intact position. Then moving over to the injured side, this we're going to demonstrate what would happen for a positive test. So we're going to put the knee in slight flexion, support the foot and the leg, and then for the positive test, we would pull the foot and we would have a decent amount of give, showing that the ATFL would not be intact and there would be a slight tear.
So next we're going to be performing the neuroma test. So this is another bilateral test that we're going to do first with the uninjured side. And so basically this test is to see if there's any interdigital nerve damage. So what we're going to do is we're going to grasp the midfoot, and we're going to squeeze so that the metatarsals are pinched together. And so with a negative test, there's going to be no pain here. But so if there was a positive test, what you're going to do is you're going to go to the web spaces and you're going to push them. You're going to push in, and this should relieve the symptoms. So we're going to move over here to the involved side, the injured side that would be getting a positive test on. We're going to do the same thing. Grasp midfoot and squeeze the metatarsals together. The patient would have pain from this happening. So this is when you would come to the web space of the feet and you would push inward, and this would relieve the symptoms.
All right, so we're going to be looking at the insertion point of the peroneus brevis. So it originates off the lateral shaft of the fibula, and then it runs down and inserts off the styloid process of the 5th metatarsal. And the peroneus brevis action is for eversion of the foot and plantar flexion. All right, so we're going to perform a manual muscle test on the glute max, which originates off the posterior ilium and then inserts down onto the IT band. So we're going to have the patient curl their leg up, support them on the hips and on the hamstrings, and then we're going to have the patient push up on their own without any resistance. There we go. And then we're going to have them perform a with resistance too, so push against me. Perfect. And then we're going to do the other side too. So curl your leg up, and then without resistance. Perfect. And then with resistance. Perfect. So the patient was able to perform a positive manual muscle test with resistance.
All right, so next we're going to do the manual muscle test for the semitendinosus. The semitendinosus aids in knee flexion. So what we're going to do is we're going to support the hip, and we're going to have the patient lay prone and bring their knee up into flexion without any resistance first. Nice. And next we're going to apply pressure to the posterior ankle, and we're going to go through the same motion. Nice. So now we're going to go to the other side, testing bilaterally. If you want to come over this side.
Yeah.
So we're going to do the same thing. Support the hip. Patient brings their knee into flexion all the way. Nice. We'll go back down. So now we'll apply pressure. Go up. Nice.
All right, so we're going to perform a manual muscle test on the glute max, which aids in hip extension and originates off the posterior ilium and inserts down into the IT band. So to perform the test, we're going to have the patient go into knee flexion, and then without resistance, we're going to have them lift their leg up just like that, and then we're going to support the posterior hips and the hamstrings, and then have them push with resistance. Perfect. And then we're going to do the same thing on the other side. Have them perfect, and then lift the leg without resistance, and then with resistance. Perfect.
Go.
All right, so to perform the manual muscle test on the tibialis anterior, which originates on the tibial condyle and inserts down onto the medial cuneiform. The muscle aids in dorsiflexion of the foot, inversion of the foot, and adduction of the foot. So we're gonna have the patient go into dorsiflexion on their own. Make sure they can do it. Up. Oh, I'm slow. Other side too. Perfect. And then we're gonna add resistance. So right on the top of the foot, and then push against me. Perfect. And then same thing on the other side, and perfect. All right. So first we're gonna test the dermatomes off the lumbar plexus. We're gonna start with L2, which comes right across the proximal thigh. So we're gonna have the patient close their eyes, and I'm gonna have you tell me if it feels the same on both sides. Okay. So we're gonna stroke first. Same both sides.
Yep.
Then we're gonna push. Same both sides.
Yep.
And pinch.
Yep.
Perfect. Next, we're going to do L4, which comes across the knee, down the medial aspect of the tibial crest into the medial foot. So we're going to start up here. So same both sides.
Yep.
Same both sides.
Yep.
And same both sides.
Yep.
Here. Same both sides.
Yep.
Same.
Yep.
And same.
Yep.
And the foot. Same.
Yep.
Same.
Yep.
And same. Next, we're going to do L5, which comes down the lateral leg and then lateral aspect of the tibial crest onto the dorsum of the foot, avoiding the greater toe. So we're going to start up here. So same both sides.
Yep.
Same both sides.
Yep.
Same both sides.
Yep.
And same both sides.
Yep.
Same.
Yep.
Same.
Yep.
And same. That order.
Yep.
And then same both sides.
Yep.
Same.
Yep.
And same. And then next we're going to have the patient lay prone. I'm going to test the dermatomes on the sacral plexus, S1 and S2. So S2 is going to come down the medial aspect of the posterior thigh, and then it's going to skip over the lower leg and then go straight down onto the medial arch of the foot. So we're going to start up here, same on both sides.
Yep.
Same.
Yep.
And same.
Yep.
And then down to the arch of the foot, same on both sides.
Yep.
Same.
Yep.
And same.
Yep.
Lastly, we're going to do S1, which just comes down the lateral aspect of the posterior leg, and then down across the gastrocnemius, and then down to the lateral aspect of the foot. So same on both sides.
Yep.
Same.
Yep.
Same.
Yep.
And then same on both sides.
Yep.
Same.
Yep.
And same.
Yep.
And same.
Yep.
Same.
Yep.
And same.
So next we're going to do the manual muscle test for the semitendinosus. So the semitendinosus aids in knee flexion. The origin is the ischial tuberosity and the insertion is the pes anserine. So what we're going to do is we are going to support the hip, and we're going to have the patient internally rotate their feet so we can single out the semitendinosus. And what we're going to do, we're going to have them bring their knee into full flexion. Nice, back down. And then we're going to apply pressure and go through the same range of motion. Good. So we're going to move to the other side, performing bilaterally. We're going to have to do the same thing. Hand on the hip, foot internally rotated, go all the way up. Nice. Now with resistance, all the way up, and good. All right, so continuing with the myotomes, we're going to move on to S1, which is plantar flexion, foot eversion, and hip extension. So what we're going to start with for plantar flexion is we're going to have the patient basically push their toes backward. Perfect. And what we're going to do, we'll support we're going to support the back of the foot and the back of the tibia. I'll have them push. There you go. Good. Do the same on the other side. We're going to put our hand on the back of the foot. Oh yeah, do it first yourself. Perfect. Hand on the back of the foot, back of the tibia, push. Perfect. Come back over here. We'll move on to foot eversion. So we're basically going to have the patient angle their foot that way. Nice. We'll add resistance. Good. We'll do it on the other side. We'll do it ourselves first. Perfect. Add resistance to the lateral border. Awesome. We'll come back over here and we're going to go to hip extension. So I'm going to have you basically lift your leg like you're doing a glute bridge. Perfect. We're going to add support to the hip. We're going to add pressure to the back of the thigh and go. Good. Come back over here. Again, we'll support the hip, pressure on the back of the thigh, push. Good.
All right, so we're going to assess the superficial peroneal nerve, which innervates the peroneus brevis and peroneus longus. And to assess this nerve innervation, you're going to stroke the lateral distal 1/3 of the tibia and then down onto the dorsum of the foot. And its motor function is for foot eversion and plantar flexion. So we're going to add resistance and have them evert their foot. Oh, this way. Perfect. And then we're going to test for plantar flexion. So you're going to push your toes down into me. And perfect. So we're going to test the other side now. So we're going to stroke again, stroke the distal lateral 1/3 of the tibia onto the dorsum of the foot. And then add resistance, have them evert. Perfect. And then plantar flex down into me.
So now we're going to test the femoral peripheral nerve. So we're going to stroke the thigh, and we're going to support the iliac crest, put our hand on the distal tibia, and you're going to push. So that's knee extension. So we'll go to the other side. Again, stroke thigh, support iliac crest, hand on distal tibia, and push.
All right, so we're going to assess the superior gluteal peripheral nerve, which innervates the gluteus minimus and medius, along with the tensor fascia lata. So to assess this, we're going to stroke the superior aspect of the glutes, and then we're going to test for hip abduction. So we're going to support the patient's hips and the proximal aspect of the tibia, and then have them hip abduct with resistance. Perfect. And then we have to assess bilaterally, so have side lie on the other side. And then same thing, stroke the superior aspect of the glute, and then support the hips and the proximal tibia and hip abduct. Perfect.
All right, so now we're going to test the tibial peripheral nerve. So what we're going to do, we're going to have our patient lay prone, and we're going to stroke the posterior aspect of the gastrocnemius. And then what we're going to do is we are going to test inversion. So we're going to apply pressure, push. And then we're going to test plantar flexion. So we're going to push against the toes and push.